Thank you all for joining me. Over the past few weeks, I've emphasized that every Pennsylvanian has a part to play in getting us through this crisis with the best outcomes for our health and for our economy. And we're already seeing some of the results of these efforts. New case rates that are declining even while most other states have plateaued or are increasing. More Pennsylvanians engaging in activities outside the home. Testing at more than 300 locations across the state in almost every county, totaling nearly 80,000 Pennsylvanians per week. A state program that is investigating every new case of COVID-19 and identifying their contacts. Those contacts are followed for 14 days. As of today, we're tracing 2,000 Pennsylvanians, in addition to the work being done by county and municipal health departments. We accomplished these feats through the hard work and sacrifice of everyone. Individual Pennsylvanians who every day take part in social distancing and hygiene efforts to curb the spread of this virus, as well as the numerous businesses that have made use of their facilities to manufacture much-needed supplies. And I want to highlight just a few of these efforts. Textile manufacturer Gitman Brothers in Schuylkill County. They retooled their operations to create antimicrobial hospital gowns. In Pittsburgh, Day Owl, a division of Thread International, shifted its focus from making backpacks and other products to creating protective face shields for the hospital network. The company hired 15 more people in order to make thousands of shields per week. Major League Baseball and Easton-based sports apparel company Fanatics halted production of baseball jerseys and instead produced safety masks and gowns for healthcare workers. They then generously donated hundreds of thousands of these masks to the state. Crazy Errands in Norristown transitioned from making thinking putty, a learning slime for children, to manufacturing hand sanitizer. And they've been donating this hand sanitizer to municipal workers, healthcare facilities, public utilities, and first responders in the Norristown and Philadelphia communities. New Pig Energy of Tyrone typically focuses on containment in the energy sector, but expanded its operations to manufacture full face shields. United Metal Fabricators in Johnstown, Cambria County, which makes medical equipment, worked to provide emergency beds for field hospitals all across the country. And employees at Brascom America in Delaware County sheltered at their workplace for 28 days to make the raw material needed to make N95 masks, medical protective equipment, and protective food packaging. These are just a few of the stories of Pennsylvania's businesses and employees going above and beyond to assist during this crisis. Through the Department of Community and Economic Development's manufacturing call to action portal and a critical medical supply portal, businesses connected with each other to work collaboratively toward the common goal of assisting Pennsylvanians during this pandemic. Many of these production efforts are still ongoing and are continuing to help us build our stockpile in anticipation of a resurgence. Whether big or small, I am grateful to every business and every worker who assisted in this effort. As I said, everyone has a part to play, so thank you for playing yours. Now I'm going to turn things over to Secretary Dr. Rachel Levine for her daily update. Secretary Levine.
Thank you, Governor. Here is our latest update on COVID-19 in Pennsylvania. As of 12 a.m. this morning, we have 780 new cases of COVID-19. This brings our statewide total to 69,417 Pennsylvanians who have tested positive for COVID-19 in all 67 counties. Tragically, 5,265 deaths have now been attributed to COVID-19. It's important to remember that while our total number of cases will continue to increase, new positive cases being reported each day continue to decline. This is good news for Pennsylvania, especially as we have added more testing, as we have discussed this week. Regionally, we are seeing some fluctuation of case counts, but overall, they are trending downward. Statewide, we are now estimating that 62% of people with COVID-19 have recovered. As I mentioned yesterday, we are carefully watching the MIS-C syndrome in children. We now have 13 confirmed cases of children ages 11 months to 18 years of age, and 10 cases are currently under investigation. As we move forward together, the stories of people like the ones that the governor just highlighted show us the true spirit of Pennsylvanians. We are all willing to do our part to help one another and support those on the front lines fighting this invisible enemy, COVID-19. At the Department of Health, we are continuing our efforts to find and distribute the personal protective equipment, or PPE, to those providing direct care to Pennsylvanians who have been impacted by COVID-19. To date, we have distributed nearly 5 million N95 masks, nearly 300,000 hospital gowns, more than 1.6 million procedure masks, nearly 2 million sets of gloves, and nearly 180,000 face shields. In addition, more than 300,000 bottles of hand sanitizer. These critical materials have gone to hospitals, long-term care living facilities, counties, and state agencies such as the Pennsylvania State Police and the Department of Corrections. Thank you so much to Pennsylvania businesses who are also working to support our efforts, either by supplying first responders with PPE or supplying other businesses with the equipment they need to go back to work. We need your continued efforts to increase our supply of the necessary personal protective equipment to protect Pennsylvanians. It is truly inspiring to see how our community in Pennsylvania has come together. And here are our daily reminders. Please wash your hands with soap and water for at least 20 seconds, or the time it takes to sing Happy Birthday twice. Use hand sanitizer if soap and water are not available. Cover any coughs or sneezes with your elbow, not with your hands. Please don't touch your face, especially after touching surfaces, and clean surfaces frequently. If you have to go out for activities, please wear a mask if you're going to come into contact with others. If you have questions about your health, please contact your health care provider. If you need mental health resources because you or someone you know is experiencing a mental health crisis, please contact the crisis text line by texting PA to 741-741 or call the statewide support and referral helpline at 1-855-284-2494. Again, 1-855-284-2494. If you or someone you care about needs help with a substance use disorder, please call the Department of Drug and Alcohol Program's Get Help Now hotline at 1-800-662-HELP. Again, 1-800-662-HELP. For the most reliable information about Pennsylvania's response to COVID-19, please visit our website at health.pa.gov. And what is most important for Pennsylvanians to remember is stay calm, stay home, and stay safe. And now the Governor and I are pleased to answer questions.
Thank you, Secretary. Our first question for you is from WESB. Here on the Northern Tier, our listeners have gotten used to hearing updates from New York counties on the number of cases in each county that have recovered from the virus. They are still eager to find out how many cases in our own counties have recovered and how many are still active. Are there any plans to start releasing recovery numbers on the county level?
Well, as you know, we have actually just started to release recovery numbers in the last week or so. At the present time, we don't plan to get granular to the county level. And as we discussed before, this is an estimate, as it is an estimate in other states. So right now, we're going to be staying with the statewide recovery number total.
From the public source, are residential treatment facilities included with long-term care facilities? And if so, Why isn't Hoffman Homes for Youth included in your facility list of skilled and licensed nursing facilities and our personal care homes?
Well, right now we've been concentrating on the long-term care living facilities in our counts where seniors live. And so we, of course, know that seniors are the most vulnerable to COVID-19, especially those seniors with chronic medical conditions. But we certainly have been including, in terms of all of our efforts, all of those type of facilities, and will continue to provide them with whatever they need to take care of their residents.
From the Tribune Democrat, as summer arrives, people are going to be traveling. What advice do you have beyond avoiding large gatherings, wearing masks, and the rest of your daily reminders? Are there precautions you can take when using public restrooms or visiting family and friends' homes?
Well, so as we've been saying, as we progress in all of our counties to the yellow zone at the end of next week and then on into the green zone, we still want people to be very careful and very vigilant about their potential exposure to COVID-19. We want people to continue to social distance. We want people to continue to wear masks. We want people to continue to wash their hands on a very frequent basis, to use hand sanitizer on a frequent basis, and to take precautions to avoid exposure to this respiratory virus as much as they possibly can.
From WESA, should parents in the yellow zone allow their children to have play dates, and under what circumstances would that be okay?
In the yellow zone, I would really try to limit something like play dates. I think that would be more appropriate for the green zone. So we know that sometimes there will be some interactions, but overall, if counties are still in yellow, then yellow means caution, and we want people to maintain that type of caution in terms of their daily activities.
From the Scranton Times-Tribune on NPR Saturday, the co-founder of the COVID Tracking Project questioned counting the results of antibody tests and virus tests as positives. Could you address this?
Sure. As we described over the last week or so, we are counting antibody tests in our general positive case count for the day. However, on our website and in all of our thinking, we do separate that. We have confirmed cases where there has been a confirmed positive case test result of COVID-19 for the virus itself. And then we have probable cases. The vast majority of the probable cases are those who have had very close contact with someone with a positive test, but they themselves had not been tested, but they've been ill. And then we have a very small number of antibody tests. Actually, less than 1% of the total number of positives are in that antibody test bucket. However, whenever we make decisions, we're not counting probable cases at all. And all that detail is available on our website. For any decisions about counties that have gone from red to yellow or yellow to green, we're only using the confirmed positive case count.
From the Post-Gazette, what has the contact tracing team for the state found out about the people who are testing positive in the last few weeks? Beyond people living and working in nursing homes, are there any commonalities? In other words, have they traveled away from home recently, went to a large gathering, or maybe went to a crowded store?
Most have not attended any particular large gatherings or done a significant amount of travel. I don't have specific granular detail about specific cases, but many of the cases are associated with outbreaks. We talked about long-term care living facilities. Others would include those positive cases in the food industry, food manufacturers, processing, etc., or in stores. But there is still community spread of COVID-19 in Pennsylvania, and that is how many people get exposed.
Our next questions are for the governor. Governor, from KYW News Radio, Montgomery County is asking a common pleas court to extend the deadline for mail-in ballots to June 9th. With some of the counties dealing with more than double the mail-in requests they expected and Postal Service delays up to 8 to 10 days, has there been consideration at the state level of extending the deadline?
Yeah, and I would be supportive of that, but that would take legislation, and I'm not aware of interest on the part of the General Assembly.
From PA Post, as I imagine you're aware with the lawsuit, again, additional counties are asking for more time would you be able to issue an executive order or some other mechanism given the absence of legislative action?
I don't think so. I don't think I could do that. I think that requires legislation from the General Assembly.
And then also from PA Post, the Department of State says neither the state nor counties can require voters to wear masks at the polls, but it couldn't provide a source or basis for that position. Can the Governor's Office, Department of Health, or the General Counsel provide that?
That's a good question. I don't know. We'll certainly look into that and have the Communications Department get back to you.
From WQKY, restaurants, bars, hairdressers, and youth sports teams understand they can open, expand service, and begin practices with guidelines tomorrow in the green counties, but are asking for specific guidelines, such as do servers need to wear masks, can concession stands at ball fields open, cleaning precautions for salons. Do you have a document outlining detailed information for the green phase?
The guidelines, I believe, will be out today, if they're not already out in the next hour or so. And if there are things that leave in those guidelines that leave some ambiguity or some questions, we also will post up-to-date, frequently asked questions. And if there's still issues, I want to hear about them.
From the Associated Press, can you please explain the circumstances that led to your administration appointing an acting commandant at the Southeastern Veterans Center?
Just, again, the general concern that has been expressed by a number of people that we ought to be taking a look at the Southeast Veterans Center.
From CNHI, your guidance indicates that you want people to continue wearing masks in public. Can you clarify whether a business that serves the public is required to refuse entry to customers who are not wearing masks in the green phase counties, and how has the mask requirement changed for those counties?
I think we've left it up to the individual businesses to make that decision. It's their property, it's their business, and they have the right to demand of their patrons sort of the no shirt, no shoes, no service. It's sort of I guess, an add-on to that.
From Fox 56, Lycoming County is not set to move to green this Friday, but its commissioners have sent a letter asking for the move. They are rural and were moved to yellow early on. Why were they not included in the first wave of green counties?
Again, we keep looking at the whole bunch of things, including the decline in the rate. But what we're looking at is the risk, as we see it, that this virus is going to infect more people and create more problems and for the safety of the citizens there. So it was our estimation that Lycoming County was not yet ready to go from yellow to green.
From WKOK, what's next after counties go green?
Well, that's a great question. I think for all of us, there's a new normal, and none of us at this point can tell. I mean, the hope is we'll get a vaccine soon, or therapies. Companies are talking about working madly, feverishly to develop therapeutics to address the needs here. So we're all waiting. There's a lot of uncertainty. We don't have enough testing yet. I think we have bought time, which was the idea of what we've done over the past 2 months, to buy time to allow our healthcare systems to develop the capacities they need. And so we've done a lot of things. As to what the future beyond green holds at this point, I think we're all still working on that. I know, Dr. Levine, do you want to add anything to that?
Sure. Well, as the governor was saying, this is going to be a new normal. We expect for the foreseeable future that we will recommend that people wear masks when they're outside, that they continue to be really, really careful about washing their hands and using hand sanitizer, that they continue to practice social distancing and just be careful about their exposure to this respiratory virus. There are many, many research studies about different treatments. We do have a treatment, remdesivir, that is an intravenous treatment used for very ill patients in the hospital with COVID-19. I know that there are many clinical trials going on about future treatments. The federal government has been talking about potential vaccines that are in development. We'll see. Those things sometimes take time in terms of vaccine development, but I think that would be certainly a remarkable development to protect people from this virus. There has been discussion that there might be a resurgence in the fall. Dr. Fauci said the last day or so that maybe or maybe not. We're going to have to see. And what we're going to do is to be prepared. We're going to continue to be testing and to continue to expand our testing. We have done that. We're going to continue to expand it further. We have an aspirational testing plan under the governor's leadership, which would really require, hopefully, the development of a very rapid, accurate point-of-care test that could be done very rapidly, even by a layperson or maybe even at home. That would be very, very helpful. And then we will continue to do our investigations of positive tests, our contact tracing, appropriate isolation and quarantine, and try to keep any outbreaks under control. I think that is the future right now in the green zone, sir.
Back to me.
Back to you, sir. 6ABC has some questions about elections. First, Senator Art Haywood is calling for a 7-day extension to count potentially 1.6 million mail-in ballots. Are you looking at an extension?
And I'm not sure exactly what Senator Haywood is suggesting. If the extension is before the election, we only have now, less than a week before the primary election on June 2nd. I was interested and would have supported up to a 2-week extension before the election. Unfortunately, they couldn't get enough votes in the General Assembly for that, so we ended up moving the counting to 7 a.m. on Election Day from when it used to be. In terms of extending from the election date, from that 7 a.m. time, it'll take as long as it takes, and I think that's how other states have done it, and that's how the counties and communities will do here.
6ABC also asked, are you aware of the backlog in receiving ballots? Our data analysis found that Delaware County residents have waited on average 21 days to receive theirs. In Bucks County, it's 2 weeks, and in Philadelphia and Montgomery, it's an 11-day wait.
Yeah, I don't know the exact numbers. My wife and I both applied for absentee mail-in ballots in York County, and it took a couple weeks.
And then we've also heard from many viewers concerned that they will not receive their ballots on time. Can they vote at the polls if they're registered for a mail-in ballot and did not receive it?
I think they have to get what's called a provisional ballot if they have applied and have not received the ballot, they can vote. I think if they have received a ballot and have voted by mail, but they're concerned that it hasn't been counted, they have to take a provisional ballot at the polling. But I think maybe we could just have someone confirm that.
From ABC 27, what is your biggest regret or decision policy choice that you would change thus far in your administration's response to the COVID-19 crisis?
That's a good question. I think we're too early on in the process to start talking about regrets. I think down the road, as we look back on this, and there will inevitably be things that we look back on and say, maybe I should have done this or maybe I should have done that. Right now, I think like every other decision maker around the world, all of us, each of us, is trying to do what we can to keep people safe, and we're making decisions on the run as the decision time comes up, and we're doing the best we can. Down the road, I think we'll all be able to look back and say there might be a better roadmap.
From the Philadelphia Inquirer, what do you say to restaurant owners who say they can't survive at 50% occupancy in the green zone?
Yeah, this is an issue that I think all businesses that have some personal care or are all facing. The business model under one set of circumstances may change. We have been working with the Pennsylvania Restaurant and Lodging Association to develop guidelines, and we're doing the best we can. Again, this is not a matter of regulations. This is a matter of what is it going to take to make patrons, customers, feel confident that they can come back to eat in a restaurant. What is it going to take to make employees feel safe working in a restaurant? And what we're all trying to do is identify those things that will be most likely to keep the virus at bay. And that has to be, I think, whether you're a restaurant owner or public policy maker, that has to be your first priority, and that is certainly mine.
From News Talk 104.1, Governor Wolf, will driver's license centers be able to start testing for driver's licenses?
Yes, in the yellow.
And then also from 104.1, minor league baseball has been placed on hold during the pandemic. Do you have any guidance for those teams when the seasons can begin?
Yeah, as I said, we have been working with sports organizations, both professional and amateur, to put out guidelines that they can follow. And I think they're all out. But as I said earlier, if there are things that haven't been covered in those guidelines, we're very happy to look at expanding them.
From WJAC, Governor Wolf, if a county moves from red to yellow or from yellow to green, and residents still do not feel safe going to work, will they still be allowed to collect unemployment benefits until the state reopens till its full capacity?
Yeah, that's done on a case-by-case basis, and employees have a number of avenues of appeal, including to the unemployment compensation system. So that is decided on a case-by-case basis.
And then from WGAC as well, we've seen some businesses that have been the targets of crimes or vandalism after they announced they would reopen ahead of approval. Will you still encourage complete prosecution of those who commit those crimes against businesses, despite those businesses opening before approval?
Well, I don't know what you mean by prosecution. Yeah, I mean, they're breaking the law, and local law enforcement officials should enforce the law, and licensing organizations should make sure that businesses are compliant. But I think that, again, the big challenge here is keeping people safe. If I'm a business owner, I'm going to keep my workers safe. I'm going to keep my customers safe. And the ultimate sanction here is not some regulation or some law enforcement official. It's what's best, what's most likely to be the safest for the people I care about most, my employees and my customers.
From WKOK, will the updated green phase guidelines coming this week be enforceable by law, or are they just guidelines that are suggested?
I'm not a lawyer, so I'm not sure I believe they have the effect of law. But obviously, as in all these things, there are 13 million Pennsylvanians, and there are a million businesses, tens, hundreds of thousands of businesses in Pennsylvania. The point of all this is that people have to feel confident. They have to feel confident going to work. They have to feel confident going to purchase something. They have to feel confident going to school. And that confidence comes not from adhering to some abstract principle or law. It comes from keeping people safe, from defeating this virus. That's what we're all about. And to the extent we can do that, each of us, working as individuals, as individual businesses, that's how we're going to defeat this.
And then from the PLS Reporter, in regard to the budget passed yesterday by the House, Democratic lawmakers have expressed concerns with a $300 million shortfall in gaming revenue used for property tax relief. Has your administration looked into any ways of backfilling that shortfall with other funds?
Yeah, we have, and I think we have a solution to that. There should be no increase in property taxes, and we do have a way to fill that shortfall if and when it arises.
And from the Citizens' Voice, as counties move from yellow to green, what is being done to help protect vulnerable senior citizens, especially those who work part-time in retail to supplement their Social Security? Do you have recommendations for those who have fear of returning to retail work and also of losing their jobs?
Yeah, again, as we move into this new normal, we're all going to have to live differently. We're going to have to practice social distancing. We're going to have to wear masks. And I would hope that going back to work means you go back to work where you're protected as a worker, where your employer takes care of you. And I think that means someone comes into the store, they should be wearing a mask.